Let us call the January 2016 meeting of the Spokane Regional Health District Board of Health to order. A roll call this afternoon. It appears we have a quorum, so let's begin with Ms. Boysen.
With me. Okay. Susan Boysen, appointed member.
Bob Lutz, appointed member.
Ben Stuckert, City of Spokane.
Chuck Hafner, City of Spokane Valley.
Joel McCullough, Spokane Regional Health District.
Al French, Spokane County.
Keith Baldwin, appointed member.
Kevin Freeman, City of Millwood.
Amber Waldref, City of Spokane.
Lori Kinnear, City of Spokane.
Michelle Fossum, Legal Counsel.
And Fitznoggle, Recording Secretary.
Thank you all. Thank you all, and appreciate you bearing with me for my first meeting in the role of chair, so thank you. Now on the agenda we have item number 3, citizen input. Anybody on the agenda for citizen? So seeing no citizen input, we will move to item number 4, the chair report. And I think today I'd like to take just a few minutes. Since our last meeting, we have received, with great sorrow, notification from Dr. McCullough that he will be taking a position with Providence and leaving us here. And we would like to say we appreciate Dr. McCullough's long service, and we are sorry to see him go. I'm sure he can address that more during the health officer report. We'd also like to recognize our new members on the board, which is Mr. Stuckert and Ms. Kinnear. We are awaiting an alternate member from Spokane Valley at some point. Not here today, but at some point in the future. And beyond that, I have nothing more in the chair report. So I would like to move on to item number 5 to recognize our outgoing board members, which are Todd Mielke, Mike French, Ed Pace, and John Snyder. And Mike Fagan. What? I told you. Oh, good Lord. And I get to sit next to him again, so I'm not going to hear the end of this. What a glorious beginning. So, Torney, I believe you have a presentation for our outgoing board members.
Thank you. It is really meaningful to this health department to have an engaged Board of Health who support the work that we are here to do to protect our population, doing prevention and work that we do to control disease, to guarantee safety for our population. And just as a small acknowledgement of the dedication to this board and to the work that we do at the Health District, we have a plaque for each of the departing board members. And at this point, Mike Fagan is the only one who is here. Certainly would like to recognize and thank you for your service and dedication to the board. So I appreciate it. Thank you.
Let's see here if I get this darn thing to work. Okay, come on. You'd be so kind enough to take a photograph. I appreciate that, sir.
Where's the button?
Well, you want to do this way.
Oh, there it is. Okay, smile, Mike.
Yeah.
This is the 1, 2, 3, smile. Okay.
He's taking video.
I'll give it to Ben because he does really a great job in the council.
Well, thank you very much, ladies and gentlemen. I know that we've had a pretty interesting last 2 years, and I really appreciate everybody's patience. And I know that we're going to be running into each other in the near future. So good luck as you all head off into the new year, and thank you once again.
So now I'd like to ask our Chairman Emeritus, our outgoing board chair, Chuck Hafner, to say a few words for our exiting Dr. Joel, if he doesn't mind.
I'd be more than happy to. This was kind of a bittersweet presentation I'm making, simply because Dr. Joel is leaving us, but I'm sure Providence is going to benefit very greatly from his background, his experience, and so forth. But I thought, well, rather than give you the boilerplate recognition, simply saying, he's a great guy and he provides leadership and all this kind of stuff that we go through every time we give an award. And I thought, well, wait a minute, let's talk about a few things, what leadership is all about. Guidance, direction, control, motivation, and serving. And also, we hope that leadership provides a framework that encourages others to utilize their skills and their ideas. We also hope that leadership will provide the area to listen, to inspire, to empower. Good leadership is simply causing other people to do what is needed in order to accomplish the mission and goals. For instance, here, the Regional Health District. But I can speak to that when I visited all the different departments and their leadership. And when I went to the departments and talked to the staff and to their directors, I came out of each and every one of those sessions thinking, wow, look at the skills our people have. Look at the passion they have and what they want to do. And I could kind of go on and on and on in regards to saying that probably, no question about it, we have one of the best staffs for a regional health district in the state of Washington, if not beyond that. So I thank you very much for that. But the only way that'll be and happen is because of the leadership of Dr. Joel. See, I just described you what he has done in the last 6 years. The qualities that were very evident throughout this whole region and all throughout this whole building. Years ago, I used to drive by the building and I said, boy, isn't that an odd-looking building? I said, what an ugly-looking building, I guess. But I never knew exactly what went inside of this building until I got involved with being on this health district. So, Dr. Joel, I would like to present you with the tray. As you can tell, the quality depicts what you have done for the health district. And I want to thank you on behalf of everyone here, especially the people in this community, and what you've done. And I'm sure that we'll hear more and more about you with Providence. So thank you very much.
Well, thank you, Chuck.
You're going to have to move, that's my chair.
Thank you very much, Dr. Joel, and we do appreciate your service. And thank you, Chuck, for the kind words. Appreciate it. We did have Todd Mielke come back in or just recently join us here, and so Todd, being an outgoing member of the board for many reasons, Torney would like to present you for with a plaque.
Thank you, Todd.
Yes.
Just as a token of our appreciation for your dedication and service since 2004, I had commented on how important it is for us as a health jurisdiction, as we're looking to serve this population, to have an engaged Board of Health, and we so appreciate your dedication and service and wish you the best as you move forward. Thank you so much.
Thank you.
So lastly, as part of this, we'd like to take just a couple minutes and recognize our outgoing chair. Chuck Hafner has given quite a bit of service to this board. Recently, he was named the Spokane Valley Chamber Man of the Year, and he also celebrated a birthday. So we would like to take a few minutes to honor Mr. Hafner for both of those accomplishments and thank him for his service. And so we have a brief presentation here for Chuck.
So, Mr. Chairman, just while we're preparing for this, I was cleaning through files the other day, and I came across a certificate that was from the Citizens Against Alcohol-Related Traffic Accidents, a certificate that I had received when I was a junior in high school, and it was signed by Chuck Hafner. So this is a guy that's been active for a long time in this community.
329 is not bad.
Make a wish.
Yeah, make a wish.
I make a wish that this regional health district will be, in the future, better and better and better. Thank you. That can serve as lunch today.
So thank you to all of our outgoing members, folks changing positions, and welcome to our new members. And so moving on to our next item, number 6, the Health Officer Report. Dr. Joel?
I'll interrupt you.
Very nice.
Tony made this for me. And it says on there, wow, 250 Spokane Valley Chamber Citizen of the Year Award. Happy what? Happy 84th birthday with best wishes from the Spokane Regional Health District and Board of Health. Thank you, everyone. Thank you.
Great. All right, this will be my last health officer report, and my intention was to keep it brief so that we'll have additional time for the work session. So the topics I'll be covering today is the relatively new virus infection called Zika virus, and I'd like to introduce the board to our new Human Resources Director. Many of you have heard in the news recently about this new virus called the Zika virus, and it's of significant public health importance, so I thought I'd at least introduce that to the board today. And the Zika virus is a virus, and it's spread mainly through the bite of an infected mosquito. And this mosquito species is also responsible for other tropical diseases like dengue and chikungunya. The symptoms are generally mild, and they only last for several days to a week. And the most common symptoms are rash, fever, joint pain, and red eyes. And most people do not become ill even if they're infected, only about 1 in 5. Of concern about Zika virus is that it can be passed on from the mother to the baby during pregnancy. And there's been significant reports of birth defects in those who are infected with Zika virus. So that is the major concern at this point. CDC has issued travel notices for people who are traveling to areas where Zika virus transmission is ongoing, telling people what they need to do to protect themselves against this type of infection. And also, CDC has issued warnings to pregnant women, basically tell them that they should consider postponing travel to those areas where Zika virus transmission is ongoing. And CDC is updating that information regularly on their website. In addition to that, CDC has been alerting clinicians about the Zika virus. Most folks haven't heard of this virus before, and it's relatively new. Since we didn't have this virus when I was in medical school, for example. So a lot of learning from healthcare providers. And also of significance is that this virus is not expected to be a significant disease threat within the continental U.S. And that's mainly because the mosquito species that transmits this virus is mainly found in tropical and subtropical areas. And we are not considered tropical here in Washington State. So here's a map of the current disease transmission for Zika. And so you can see that's mostly South America and Central America, and also some of the islands in the Caribbean. And finally, I'd like to introduce our new Human Resources Director, Sue Winters. Would you please stand up, please?
I start as the HR manager replacing Mark Moran February 16th. Looking forward to working with you.
Yep. The HR manager does regularly interact with the board, so I think it would be good for you to know her face. And finally, about my departure from the health district, it has been my honor to serve as the extremely high-performing public health agencies. I think the best public health agency in the state of Washington. And it's been my honor to be the public health director and health officer here. And it really doesn't feel like I'm leaving totally, because I'll still be interim health officer and still doing the work, and I'll make sure that I visit and tell jokes to people, because I think they're used to me doing that here. So I'll be sure to not be a stranger. So thank you.
Dr. Joel, before you step off, could I ask you just to give a brief summary or kind of outline of what you're going to be doing at Providence for the board?
Sure.
Just kind of let folks know, because you are staying in the community and are staying active in public health here.
Sure. My position at Providence is called the Medical Director for Community Health and Epidemiology. So I will be responsible for several areas. I'll be responsible for infection control in the inpatient and outpatient settings of all the Providence system in the Northwest. Be responsible for the developing special pathogens unit, so we'll be able to treat patients with Ebola or other special pathogens, so I'll be in charge of directing that area. Be working with the outpatient clinical system to improve their clinical prevention efforts. And I'll also be working with Providence to develop their strategies to improve their reach in population health. So those would be the key areas that I'll be working on. So thank you.
Thank you very much. Sure. Are there any questions for Dr. Joel in his last health officer report? Anything?
Well, Dr. Joel, thank you for your service. It's going to be hard to see you go, but good to know that we can lean on you in your other capacity, and it'll be good to be partnering with Providence in the same areas that we work on here. So thank you. I just had a question about the Zika virus. So if you are traveling to those areas, Mexico, South America, the Caribbean, is there anything you should do especially to prevent being exposed to the disease, or does it impact children different than it does adults?
So most people do have pretty mild symptoms as I outlined there. Certainly they're... sorry about that. In terms of the precautions, they're the same precautions as you would have for most mosquito bites here. So use mosquito repellent and repellent on your clothing and that type of thing. One of the things about this particular species of mosquito that it bites any time during the day, so you just wouldn't be concerned at night. So you have to be vigilant 24 hours a day, basically, when you're in those areas. So the CDC recommendations regarding protection is just use repellent and other protective measures. There's other measures that would have to be done in areas in terms of wider array of mosquito control activities, but that's generally done by the local areas there. But it's mostly personal protection as it relates to mosquito repellents for individuals who are traveling.
Just quickly, I understand it's transmitted by mosquitoes when you're in those particular areas. Can it be transmitted any other way? For instance, I've heard there's quite a few people who've traveled and then shown up with it here back in the United States. Is there any other transmission modality for the disease?
The main transmission is via mosquito, by an infected mosquito biting you. There have been some reports of sexually transmitted transmission, but those are still under investigation at this point. So So you would have, basically, for this area, person would have to travel to those areas and be bitten, and that's how they would get it, because you're not going to get a locally acquired transmission here in Washington State. And I think I said that the mosquito that's responsible for this has never been identified in the state of Washington. Yeah.
Any other questions? Next, moving on to our legislative report with Linda Graham.
Thank you. Well, to start, just for benefit of our new person, Lori, part of my role as our policy manager is I work with the Board of Health every year to develop a legislative agenda, and we do that during the fall, and then it's passed by the board in December. And then I spend, particularly during legislative session, but also during the interim, working with our legislators in conjunction with partners throughout the state to try and actually get some action related to those the legislative agenda. So in your packet, I included a document that has your legislative agenda items down the one side and then is showing some of the bills that are in play right now in the legislature related to those items. I did not include the current status of these because it would have been out of date already. We're in a short session. Things are moving fast. There's also probably another 10 bills that have been added since the time I did this and got it in your packet. So what I can do is update this and then send it out to you if you would like to see kind of the latest update on this after the meeting. So, but are there any questions related to those?
When is the bill cut off this year?
The first one is next week. Yeah.
Okay. Thank you.
Sure. Anything else? All right. Thank you very much.
Thank you. So, item number 8, consent agenda, consisting of the meeting minutes from the December 2015 meeting and vouchers for November and December. Any comments from the board on either of those items?
I make a motion to make that.
Second.
Moved and seconded. Discussion. None. All in favor?
Aye.
Any opposed? None. The agenda is passed. So item number 9 is an executive session dealing with matters pursuant to personnel.
Right. The board will meet for about 10 minutes in executive session pursuant to RCW 4230-110-1G related to salary for a public employee.
I'd like to ask the Human Resources Manager and Board Attorney to remain, and if we could ask the rest of you to exit for approximately 10 minutes for the executive session, we will reconvene after that. Thank you. We have closed the executive session and are moving on to our action items. Our first action item is item 10A, an interim director salary, recognizing the change in position for our Tony Smith. Do I have a motion?
Yeah, in recognition of the change. I have this on, sorry. It off. In recognition of the change in job duties, I'll make a motion to increase the monthly salary by $24.75 a month in the interim starting on February 16th, 2016.
I'll second that motion.
Moved and seconded. Discussion? Mr. Mielke?
And that's just to clarify, that's $2,475?
Yes, absolutely. I'll clarify my motion. $2,475 a month.
So, and this is just to recognize, having been here when we were in a time when we didn't have a health officer, I know that there is an extra workload that gets placed on the administrator. And so it's not just the normal duties that the administrator does, but also there's a lot of coordination up to, but not quite, recognizing that only a doctor can perform the medical functions of the position, but there's a lot of other coordination that goes on in trying to make sure that everything is covered. So, and I think last time we recognized that the time period took longer than anyone ever anticipated. So I think this is a fair adjustment. for this interim time period for this position. And I would like to say, for those that are concerned about the amounts, during the time that the health officer position is vacant, that's roughly $14,500 a month. That during the time that that's vacant, we'll pick up an interim health officer for much less than that. And even with this adjustment, there's substantially less money going out the door. So during that interim period, it is a net gain to the health district's financial position.
Any other discussion? All in favor?
Aye.
Any opposed? Thank you. Next is item B, an interim health officer contract. And in your packets, you had received the agreement for interim health officer services. We have just, Michelle, would you like to go over this real quick?
I sure can.
Thank you.
All right, so we tried to recite initially the scenario that the health district is in with Dr. Joel resigning, and the fact that we will need a health officer to be available for certain functions of the district while we are searching for a new health officer. So that's the recitals part there. The terms essentially are that Dr. McCullough will perform all of the duties of a normal health officer.
I'm sorry.
Yes.
As a point of order, in our last motion, we did not cite an effective date in the motion.
I did.
Yeah, we did.
Oh, you did?
Yep,
okay.
we did.
Thank you.
Sorry. It's all right. Thanks for checking.
Here we go. Just check to see Chuck caught it. He's going to be with us for quite a while. I like Ben. Michelle, please continue.
All righty. All right. So, there are some functions that have to be done by a medical doctor in the district, and so Dr. Joel will continue to do those functions as needed. So that's what's reflected by the reference to RCW 7005-070. Then we also identified some specific tasks that the staff have been able to see that they are going to need, and with Dr. Joel's input as well. The red are the input by Dr. Joel. So he will be employed as an independent contractor because he will be an employee somewhere else. It will continue from February 17th to any time that it's terminated by either Dr. Joel or the district. I put in 30 days written notice to give folks some time to adjust. And the rate that's, I think, been added in by you, Dr. Joel, is that right, was $1,000 a month plus reasonable travel expenses related to those duties, if they were required, so long as they're approved in advance by the administrator. So I think that's kind of the nuts and bolts of it.
Thank you, Michelle.
Mm-hmm.
I'm looking for a motion on the agreement.
I would make a motion to approve the agreement with a couple of typos that I mentioned to Ann. That'll be on the signed document, right?
They have been corrected, yes.
Okay.
I'll second.
Moved and seconded. Discussion? I just would like to say that in consultation with Dr. Joel, I think we're getting quite a deal for $1,000 a month, and so we thank Dr. Joel for his continued work here while we make this transition, and hope that we can do this in an effective manner. So thank you very much. Any other comments? All in favor?
Aye.
Opposed? None.
Thank you.
Next is the adoption of the 2016 meeting schedule. So have a few dates on there. No meeting in August, no meeting in November. Do I have a motion on the meeting schedule?
Make a motion to approve the meeting schedule as presented.
Second.
Discussion.
Moved and seconded. Discussion.
So the Board of Commissioners is not meeting the week of July 28th. We've already set our calendar, so I don't know if that went like this with communication with your staff, but our board is scheduled to be off that week. We set our meetings last week, 2 weeks ago. So.
Well, we've moved our meetings up a week or down a week before to adjust to other calendars, so.
I'm just letting you know that most likely you won't have any of the commissioners if you hold it on July 28th. So it's a scheduled week that we have off.
Mr. Mielke.
So I guess I would ask, based on people's calendars, if they're aware of any conflict if it was moved earlier by 1 week. Right. Yeah, you're right. You're right.
Usually STA is the third Thursday, but
we have STA.
do we take it off in July? I can't remember.
I have it, currently I still have it on my
I think
calendar.
we take off August. So that would be, STA doesn't meet the third Thursday, so that would be a conflict of moving it back a week.
We don't have to fix it right now. I mean, if you want a note, and then we can work to find a date.
Why don't we go ahead and approve this with a note to the fact that maybe, and you can put out, if you say in that particular month, what might be the best time for us.
Any other discussion on the schedule? Motion? Or all in favor?
Aye.
Aye. Any opposed?
Any opposed? None?
However, think about it, the three commissioners would not be here. That might be something we would look forward to.
You be careful, Mr. Chuck Hafner.
We've had that in the past.
I'm trying to get even. I haven't got up to the three ever, but I'm just trying to get even once in a while.
I think with that, Chuck's going to agree to chair the Finance Committee. That was a nomination.
Need that one. All right, so taking Ms. O'Quinn's quip, we are going to move on into adoption of the 2016 committees. So we are going to be looking for both, let's see, we're going to be looking for both chairs and members of these committees. And I lost my notes.
Are we volunteering or nominating?
Well, I just nominated Mr. Chuck Hafner to be chair of the Finance Committee, so I was kind of kidding, but now I'm not.
So we need...
I nominated you chair of the Finance Committee.
I'll second.
Moved and seconded. Discussion?
That teaches you a lesson that you can't pick on the commissioners anymore.
I don't see any discussion. All in favor?
Aye.
Mr. Hafner is now the chair of the Finance Committee. You're not going to get one. Education and Communications Committee. Any nomination for... Oh, I'm sorry, Amber. I apologize. Smack me.
No, I was just going to comment. I couldn't remember, Councilman Snyder had chaired one of the committees. Was it the policy committee? Because I was going to, that was the governance committee on here, you mean?
Policy advisory, second side.
Oh, backside.
That one.
Okay, so when we get to that, I'd be willing to step into that role, so I'll wait till we get to the next side of the page.
You will chair that, Amber?
But we're on education and communications right now.
We can bounce around. It's like just searching for a minute.
Nomination for Councilmember Waldref to be chair of the policy committee.
I'll second that.
Moved and seconded.
Moved and seconded. All in favor?
Aye.
So now that we've had our dessert, let's go back to dinner. Education and Communications Committee. Any nominations for chair of that?
I would nominate Bob Lutz for education, please.
Well, Can I ask a question first, Chuck? I thought we had talked several times in the governance committee about combining the education committee with the governance committee. Did that go away? Combining those two? Right, we had talked about it, but we never made a decision on it. Is that still something that we want to consider?
One less committee.
There's some overlap.
One less committee meeting. Let's do it.
Well, I would ask Bob, I guess, if he's willing to combine those two.
I think the challenge is, again, sort of defining the scope of both committees,
Right.
and I think that was the conversation that never really got finalized. So, I mean, I guess it comes down to, yeah, I'm willing to do it, but I also want to understand the scope of those committees. If we're combining them, what does that combination look like?
Bob, why don't you create the scope?
Oh, that's great. Thank you, Keith, for that honor.
So we're nominating Bob to be
Well,
And I'll second.
governance and education.
So I guess the question would be first, do we need some sort of motion to combine those two committees before we can have
Make a
that?
motion to that effect, we combine education and the governance committee under one.
Do we
Can
have?
include? Can we throw in the chair at the same time?
No. Well, that's confusing.
Let's do them separately, and then we know if we need two chairs or one chair.
Okay, I'll
Okay.
second that.
So moved and seconded on combining education and communications with governance. Discussion?
Is the replacement for, is that going to be running through governance, research process?
I'm going to ask Mr. Mielke, where did the search committee come out of?
I thought it was the.
It was just independent?
I mean, I was actually thinking the executive committee brought a proposal back to the full committee.
And we're getting nod from Torney that it was an ad hoc, so the search does not come out of either of those committees.
Right.
Correct. Okay.
So
does that?
We're saying out of exec's going to handle it then?
Or an ad hoc.
Or we'll appoint a separate
Ad hoc.
Right.
Okay. I'd just like to express my desire to serve on the search committee as well.
It's not on the list.
Okay. Yeah. When we make that one up. And
Where's the motion now?
okay, so right now we need a vote on combining the education and communications with governance. All in favor?
Aye.
Any opposed? Okay, so education and communications is now combined with governance. So now we're taking nominations for the chair for the newly combined committee.
I'll nominate Bob Lutz to be the new committee chair of the combined committee.
I'll second that.
Moved and seconded. Discussion. No discussion. All in favor? Oh, wait, Mr. Mielke.
So I think Bob posed the question saying, well, what exactly is this committee doing? And as I look at the definition of the committee assignments, so under the executive committee, it does say develop performance standards and monitor performance of the board. And when we talk about the governance committee, reinforcement of member performance expectations, it seems like there's a couple things that we currently list under the governance committee that might be able to transfer over to the executive committee, and then basically have the governance committee. I don't think that'll be the appropriate name in the future, but really I think it is about an education component, both for making sure the board is aware of its function, but also education component about the health district's role in educating the public. And with that education, I think it's integrated with communication as well. So I do notice under governance, we have increasing member understanding of public health. I think that's kind of a education role. So I do think that we just change the name and shuffle the deck a little bit with regard to expectations, and we can refine these committees.
Any comments on Keith?
Well, just to clarify what Todd is sort of saying, is the governance committee was really created to do some updates to board function, board policy, a number of things. And as we completed those things, we assessed them. But I think it's still up to the executive committee to define some parameters that the board must meet in terms of its operations, let's say. So I think the governance committee was never intended to be on a full-time basis forever adjusting how the board operates. I think it really was more of a discussion around where do we want to go, and once those things were incorporated, then I presume they would move on. So I think you're right, those things can be incorporated into other committees. So I would agree with that.
And also, Todd, in regards to the governance committee, there were certain items that we were trying to get the total board involved in. And this was one of the opportunities of getting other members of the board involved in the operations of the board itself, and so that we be made aware of that. So your concerns, I think, can be taken care of as the committees meet and determine which direction we're going to go at that time.
I think we almost started the discussion of saying, well, we're going to eliminate education communications and move some of its functions into governance. I actually think we're doing the opposite. We're kind of eliminating the governance committee, moving some of its functions into either the executive committee or communication, and we're really kind of keeping the education and communications committee alive and reinvigorating it. I do see perhaps under the executive committee we could add a bullet point that says, assist in administrative functions necessary for the success of the board, something like that, because then you capture a lot of the stuff that this committee did and put together.
I'm kind of flexible on that. Any other discussion? So those in favor of Mr. Lutz?
Aye.
Any opposed? None? You can. You're going to lose.
So just a quick question, if I may,
Please.
Mr. Chairs. The committee meeting dates are scheduled how?
As necessary and according to members' schedules.
Commissioner Quinn?
Yes.
To date, for example, the policy and governance committees, both the dates have been set to be concurrent with the executive session. And so they've been sort of, if you look at the calendar, I think Linda should bear with me, but I think they've been sort of alternating months since they're quarterly.
Yeah, they're quarterly, and then they tend to match up with the days that the executive committee meets, because some of the same numbers are on both of them, or have been in the past.
So now that there's only one committee, they would be meeting, I assume, quarterly?
I'll be more specific. I'm supposed to be on the executive committee, and that committee meeting directly conflicts with the airport board that I sit on. So if we're going to keep that day, we'll have, if you, as vice chair, you want me to attend, we'll have to move the time. So
I think we can consider that. I have no problems with that.
9 to 11:30 today.
Is that the same time they're going to meet?
correct. That's the board. That's the actual public board meeting.
We're talking about...
I'm talking about our health board executive committee.
Which meets on the 3rd.
Which meets...
On the 3rd Thursday. And you're
Correct.
saying that
conflicts with the airport board.
Okay.
It moved this month because of GSI's trip last week. So just throwing that out there, that's a...
So we can consider an alternate time for the exec board meeting.
Thank you.
Go ahead, Chuck.
An alternate time meeting on the same day?
Same day, alternate time.
So the board meeting, the airport board meets from, 9 o'clock until 11?
Yeah, so sometime after lunch. Maybe 1.
So we may have to look at that after, yeah.
Yeah.
Okay.
Can we volunteer for committee?
Yes.
Absolutely.
Yes.
It won't work after lunch because it's STA, but we may have to look at third Wednesday or something like that, but we can figure it out.
Okay.
Figure it out.
All right. So, members for Budget and Finance Committee, we can have up to 5 members of the board on each committee. If you see your sheets there, terms and meeting dates are presented there. So looking for volunteers for the Finance Committee to assist Mr. Hafner. We've got Mr. Stuckert, Ms. Boysen, and Mr. Baldwin. Budget and Finance.
And I'll have Ann send a notice out to you for the meeting date, so we ensure that we don't have conflict.
We have 2 other slots available if any of our remaining board members. Should we put Mr. French on that?
We have one. We have one other slot because Chuck's.
Oh, Chuck's. I'm sorry. I thought it was up to 5 members. My bad. One slot left.
I was actually going to recommend that potentially the new commissioner coming in would maybe, whoever that ends up being, would be a good opportunity for them to get an understanding of the role of the health district by being involved in that committee. So that would be my recommendation.
Okay, so we will reserve that slot for the new Spokane County Commissioner.
I have no idea.
We need to keep on business here. We need to keep on board business. So, Education and Communication Committee to assist Mr. Lutz. So, do we have 4 volunteers for that? We have Ms. Kinnear, Mr. Hafner, and Ms. Boysen. One more slot. Was that 4? Chuck? Oh, we got Bob. Bob, Chuck. Susan and Laurie. Okay. Got it. Sorry. Losing?
Dean and Al.
Al.
Well, there's another committee. Save yourself.
So, Policy Advisory Committee.
Committee of 1.
Policy Advisory Committee.
I'd like to volunteer.
So we have Amber as the chair. We have Mr. Baldwin. We have 2 to 3 more slots.
Put Mr. French on that one, right?
Amber, I'll help.
Well, when you leave.
I was on that one last time, so I would also be happy to serve on that one. Okay, so myself and Mr. Hafner.
Reserve something for Dean.
And then lastly, exec member or exec committee. So we have myself, Ms. O'Quinn, chairs of the board. So we have Mr. Hafner, Mr. Lutz, and Ms. Waldref on that. So we are loaded on the exec committee. Any other comments on committees before we move off of that and move to our work session? Great. So now we will move into our working session with regarding enforcing vaping devices under the Smoking in Public Places law. Linda will begin coordinating the work session. Before Linda begins, as we go through this work session, I think it's important to remember that for this enforcement of vaping devices, that as we move forward, this is actually the board implementing policy. We will make and cause policy to be implemented and enforced. And so, please remember our responsibility in doing this as we listen to Linda's presentation. Thank you.
Thanks, Kevin. So another part of my role, Lori, is to work with the Board of Health on doing local policy work. That comes in the form of both resolutions, which are more official statements, and we can also do what are called guidelines and recommendations, which are more advisory opinions. So the work session today, as Kevin mentioned, is part of the Board of Health's consideration of enforcing vaping devices under the Smoking in Public Places law. We're not going to take action today. This is really just a work session to make sure everybody's got the information they need for the upcoming hearing, which will be next meeting in February, and then hoping for a vote from the Board of Health either in February or March. So joining me in my presentation today will be Paige McGowan. She is our tobacco, vaping, and marijuana prevention coordinator I'm glad I actually remembered to say the word prevention. I often call her the tobacco, vaping, and marijuana coordinator, which makes it sound like she's handing out drugs. Anyway, so today what we're going to do is we're going to go into detail on what is being proposed. We're going to go over the process that we've undertaken so far in putting this together and then what you can expect coming up. We're going to talk about the public health concerns related to vaping devices, talk a little bit about what you can expect to hear from proponents or opponents of the proposed action. We'll go over in detail the resolution and then hopefully have some time for you to ask questions. We'd like to ask if you could hold your questions until we're at the end, in part in the interest of time. But if you do have a question where you're just absolutely confused about something and therefore the presentation's not making sense, please do interrupt in those cases. So a couple of definitions I want to go over, and Paige is actually going to hand out some vaping devices for you to look at. These were confiscated from schools. I recommend that you leave them in the bags. A couple of them are leaking a little bit, and then one of them actually has some marijuana residue on it. So a couple of definitions then. We use the term vaping devices. Other terms are electronic cigarettes or e-cigarettes. They're called many number of things. And they, as you will see as these go around, they come in many different shapes and sizes. We refer to use of a vaping device as vaping. Retail stores that sell these, we typically call those vape shops. And then if you hear us say sip a lot, that's short for smoking in public places. Just gets a little easier to say sip. I do want to note that the Board of Health has actually heard about vaping devices quite a bit over the last few years. I did a presentation a couple years ago about federal activity around regulations. We've also talked about vaping devices in relation to the legislative agenda adopted by the board. It's currently on your legislative agenda for this year. And then last April, you had a presentation from Cindy Green with our tobacco, vaping, and marijuana program on their work and the public health concerns associated with vaping devices. So very specifically, what we are recommending is that the Board of Health pass a resolution to prohibit the use of vaping devices in public places and places of employment. This would be all the same places where smoking is prohibited. So it would also include prohibiting vaping within 25 feet of doors, windows, and ventilation intakes. It would also require signage that includes no vaping to be placed in public places and places of employment. So this work started I started actually working with the tobacco program really early on when I started here, looking at ideas on policy actions to help address all kinds of things, particularly vaping devices because they've been growing in use. And we settled on this action as the first activity to bring to the Board of Health. This idea actually was initially brought to you in Cindy's presentation last April. And we received quite a bit of support from the board and encouragement to go ahead and move forward with this action. So we then took it to our policy committee, and they wholeheartedly endorsed continuing to move forward with this action. And they also provided us some advice on the process. And just a reminder on who's on that committee, it was John Snyder, Mike Fagan, Ed Pace, Kevin Freeman, and Bob Lutz. So quite a diverse group of folks, and it was a very unanimous decision and very strong support for moving forward. I also, as part of this process, consulted with Michelle Fossum quite a bit, the attorney, both regarding the best process we should be using and going forward, and then also on the language of the resolution itself. I want to just note really early on here that this action is not banning vaping devices entirely. Nothing in this would preclude people from using vaping devices in their home or anywhere else that they would be allowed. This is also not a ban on the retail sale of vaping devices. It's simply including them under the Smoking in Public Places law. We've heard lots of concern from those who believe that vaping devices can help people quit smoking. And a couple of things to reiterate is that that hasn't been shown to be an effective way to quit smoking, and also they're not approved by the FDA. And certainly if people want to use vaping devices to try and quit smoking, they're welcome to do so. They just can't do it in public places or places of employment. An interesting note when it comes to quitting smoking, research has found that people who are trying to quit smoking, by seeing somebody else smoking, it really gives them the urge to smoke, makes it harder to quit. So when it comes to vaping devices, we feel like if they're trying to quit smoking, even seeing a vaping devices might be another trigger to then want to have a desire to smoke. So, but with this action, not only are we protecting people in public places and places of employment, it's also another way to look after those people who have quit smoking and reinforce that action. So Board of Health authority. Authority for this action comes from several sources, including the Smoking in Public Places law itself. The health district has authority to enforce that law on business owners and places of employment. The legislation also gives the Board of Health the ability to adopt regulations that are related to that enforcement activity. So that's what you'll be doing under this proposed action. As Kevin mentioned, I want to emphasize that this action is a little different from a lot of what the Board of Health does. A lot of your resolutions are more advisory, or you're asking other entities, the cities or counties, to do something. This is actually you directly creating policy and enforcing, basically, law in Spokane County. And I also want to distinguish it from some of the other proposed actions that are going on out there in terms of regulations, which actually is not very much. We actually took very early action here as a health district. The Board of Health did a resolution that was encouraging local jurisdictions to prohibit sales to minor and also to make it a penalty for minors to possess vaping devices. That was done in 2010, and that was quickly followed by adoption by several of our local jurisdictions. And then following that was action by the state, where they prohibited sales to minors, and that occurred in 2013. As you saw in the packet earlier when we talked about state legislation, there is some pending state legislation. Essentially, it will be placing vaping devices under the same state regulatory systems that tobacco is regulated under. So it's about licensing for retail sales, fees for sales to minors, those kinds of things. But nothing in that proposed legislation has to do with use of vaping devices in public places. And we're currently not expecting the state legislature to take up any action related to vaping in public places. At the federal level, I talked to you about this back in 2014. Vaping devices and products currently are not regulated at the federal level. There is what's called a deeming rule that's been proposed by the FDA. That would, again, at the federal level, put vaping devices under similar regulatory structure as tobacco products. It's really not clear at this point when that will be adopted. And again, it has nothing to do with vaping or smoking in public places. In taking this action, you will not be the only ones. There's quite a few jurisdictions at local levels and at state levels, and then there's activity in our state as well. So part of our process has actually been to talk to these local health jurisdictions in our state before and after their actions, kind of find out what their experience was. We've done a bit to try and learn from their processes, and also really looked into the details of their resolutions so we could learn from those as well. So justification for taking this action, obviously it has to do with public health concerns. As the Board of Health, that's your responsibility. So I'm going to have Paige come up and take you through some of the major concerns we have in regards to the justification.
Thank you, Linda. So first I want to share about one of our primary concerns here is about what's in the vapor or secondhand vapor. So we did show you the picture, but we haven't told you a little bit about how the devices work. So devices are used to consume a liquid solution, and that usually contains some kind of mix of nicotine, propylene glycol, or glycerin, and some type of flavor. So studies have shown that the toxins in the vapor may vary by brand, and important to note that there's over 500 brands of these things and about 7,700 flavors. So we're talking about a lot of combinations. But the vapor has been shown to contain nicotine, formaldehyde, ultrafine particles, heavy metals, and other cancer-causing agents. Of note here is that vulnerable populations, including pregnant women, youth, and people with cardiovascular conditions, may be at an elevated risk of being exposed to this vapor. And research into what is in the vapor continues to emerge, but we don't know the long-term impact of being exposed to vaping devices or vapor. One thing that you may have heard a little bit about is there is some research that says that the vapor is safer than secondhand smoke exposure. And from a public health perspective and drawing on the best available research, we still feel that there is cause for concern here about what's in the vapor. The vapor may be safer than cigarette smoke, but that does not mean it's safe. A complicating factor when it comes to secondhand smoke exposure is that these devices can be used to consume a wide variety of substances, including marijuana and other synthetic drugs. This makes it impossible for a bystander to know what they are breathing and being exposed to when somebody's using a device. And some believe that if the FDA does take action on the deeming rule, that there would be more regulation around the liquid nicotine. However, from the public health perspective and knowing that the devices can be used for other substances and synthetic drugs, regulating the actual use of a device in public places and places of employment is more important than what's actually in the liquid nicotine. The next piece here is a rapid rise of youth using vaping devices. In Spokane County in 2014, 26% of youth reported having used a vaping device, and only 12% had reported using a cigarette, so over 2 times the amount of students using a vaping device. This is of particular concern to us because of the impact that nicotine has on a developing youth. Nicotine use during adolescence is associated with lasting cognitive and behavioral impairments, including effects on memory and attention. Another concern here is nicotine addiction for a person's whole life. And lastly, some evidence is emerging that people who use a vaping device are at an elevated risk of using a cigarette in the future. Youth are very influenced by what they see, and this action would, if we took action on this, it would remove vaping devices from public places and places of employment and help to reduce the normalization of smoking. The last thing I want to point your attention to is how this is complicated enforcement. Since we haven't taken action on this yet, there's a lot of confusion in our community about what is enforced under the Smoking in Public Places law. We get a lot of calls from businesses and from just members of the public who are concerned about what's required to be enforced in a public place or place of employment. Also, businesses are asking what can they enforce, like are they allowed to prohibit vaping devices? We have also received some calls from businesses who have asked SRHD to take action because they don't want to be the only businesses that doesn't allow vaping in their place of employment because they feel that they would be at a disadvantage not welcoming people to use a vaping device. We do hear concerns that people feel that businesses should be able to implement a policy on their own, and at this point they can. When they call us, we do give them free signage, but we tell them that they're not required to enforce the Smoking in Public Places law with regards to vaping devices. And owners don't always know that they can do this, so passing a resolution here would be a way to uniformly have businesses all enforce vaping under the Smoking in Public Places law in a fair and equitable way. I'm going to turn it back over to Linda, and she's going to tell you a little bit about the process that we followed so far, and she's also going to walk you through some of the details of the resolution.
Okay, a few more details on the process we've gone through. It's amazing how long it takes to do these kinds of things. This started last spring as we talked about presentation to the Board of Health and interest in moving forward with this, supported by our policy committee. Then we spent much of the fall really working to do some public outreach. We met with vape shops, and we'll go over some of the details of what we heard in that. I believe there's actually details in your packet of what we heard from the vape shops. We did some partner outreach. We did quite a bit of media coverage. As luck would have it, we ended up in December at the 10th anniversary of Smoking in Public Places law. So that was a nice opportunity to continue to get some public outreach for what we're doing. And then we also did formal announcements to the public concerning public comment period and the upcoming public hearing. So we are currently in our public comment period. It will end on February 5th. And people can provide written comment either by mailing that in or through email. And we will be compiling those comments for the board, and you will receive those in your February board packet before the hearing. And then in February, we will be having a public hearing and hoping for a vote then after that in February or March, and we'll talk a little bit more about that. Really what we've been trying to do in this process is be very public and transparent about what we're doing. And we've been trying to follow as much as possible the Administrative Procedures Act for the state. It's not required that we do all those steps, but we've been doing that just because we want to make sure that the public is aware of what you are doing. So I want to spend a little bit of time going through the resolution itself. You do have the draft resolution in your packet. It might be helpful if you pull that out as we go through this. So the first piece, I'm not going to go through every whereas clause. If you have some questions on any of those, please let me know. But the first element after all the whereases is basically specifically including vaping devices under SIP, and it's also clarifying a few things about smoking. Under the current SIP, really all smoking is prohibited. But we're really just kind of clarifying that it does include any kind of flavored tobacco products. Typically those are used in hookah, if you're familiar with the big hookah pipes. And it includes marijuana. We just get a lot of questions about really what does smoking mean under here. So we're trying to clarify that. When it comes to vaping, you might notice we include vaping of any substance in order to cover the variety of products that can be vaped. And particularly the fact that people can create vaping stuff themselves, so we can't just regulate specifically certain cartridges or anything. So moving on to the definitions section, as I mentioned, we're really trying to be clear about what kind of products is being covered under this prohibition. So we're really trying to include what we know about existing products, what we know is coming down the pike, and basically kind of planned for who knows what may come out in the future. It's been referred to as whack-a-mole, if you're familiar with that game. New devices, new flavors, all kinds of things keep coming up all the time, so we're just trying to stay ahead of that. We're also incorporating some rulings from court cases that have dealt with the smoking in public places law, so trying to bring those in as well. So when we define smoke and smoking, we've included some terms such as combustible, smoldering, burning, and heating. And we've also given some examples of the type of products that are included in there. Clarifying the definitions related to public place. Numerous establishments, both here and elsewhere, have been trying to claim that they are not subject to SIP because they are in some ways private clubs. So this clarification kind of builds on, in particular, a Washington Supreme Court case that dealt with issues around a private club that was serving hookah. But we want it to apply to any kind of use of either smoking or hookah or vaping. And so we're really basically saying if you are doing, for all intents purposes, things like advertising, signage, and all kinds of outreach, trying to get the public to come into your club, it doesn't matter if you charge $5. You're still a public place. So that's what that's about. Place of employment. Under SIP, it already covers these areas. This is addressing things like patios and decks outside of restaurants. This really spells it out, wanting to make it really easy for business owners and for the public to understand where the prohibitions apply. So it's just making that nice and clear. And then under employee, this is also part of what came up under some Washington court action and really clarifying who is an employee for purposes of SIP. Note that an employer is considered an employee under this. This is because in some cases employers have said, well, we're not a place of employment because I'm the owner and I'm the one, either me and my co-owners are here doing the work and serving things. So we wanted to make sure we got those included under here as well. And then we had to include a definition of employer because it mentions employer under employee. We had to define that. So this was just built off of common definitions already found in state law. And I want to skip definition number 6 for sampling just for a moment. The next two definitions are for vaping and then for vaping device. These, again, are based on common definitions that we're finding in proposed state legislation and some federal proposals. Basically, again, trying to make it cover all existing and future devices that are out there. So we're including all kinds of things related to steam stones, trying to define what vapor or aerosol is, and those kind of things. So back to sampling. We specifically mentioned sampling within our definition of vaping. because we want to make it really clear that the proposed resolution includes a prohibition on sampling in retail vape shops. We are aware that this is common practice among vape shops, is to allow customers to sample the products. And during our meeting with vape shop owners, we really heard that this is a common practice because it's a part of their marketing. It's also a part of convincing potential users that they would like the product, that it actually does feel like the experience of smoking. But at this time, we are recommending against any kind of exemption for sampling because we really feel there are some significant implications. So I'd like to go over those just really quickly if I could. First of all, under the Smoking in Public Places law, it's designed to protect employees from secondhand smoke, and it does not have any exemptions. The only exemptions are 25% of hotel rooms. Also, sampling is not permitted in other kinds of retail stores for tobacco or marijuana. And there are no state or local regulations that prohibit youth from entering retail outlets. And we're particularly concerned about youth seeing certain behaviors. A lot of what they do in these stores is they have what are called cloud contests, where they're blowing smoke to see who can create the biggest cloud and how far it goes. And by youth entering a store, we don't, seeing it being normalized, seeing it being used, seeing this kind of cloud behavior going on. We're just concerned about that aspect of it as well. And also, recently, the Washington Poison Center reported a person who visited multiple vape stores, and they were sampling at all these different stores and ended up having seizures as a result, and feeling that that's particularly because of the nicotine that was in the devices. Also, delivery people, service people, maintenance people that are going into the vape stores will be exposed to the secondhand vapor. Tacoma Pierce initially had an exemption for sampling in stores, and they ended up receiving a lot of complaints from the service people and maintenance people that are having to go into these stores. And so they've actually gone back and changed their resolution concerning vaping devices in public places to actually get rid of the exemption for sampling. And then lastly, it kind of goes back to some of the enforcement issues that Paige talked about earlier. We primarily do enforcement based on complaints that we receive. So if we have some vaping activity going on in one place, it's not in others, given that we're relying on the public seeing these things, I think it could cause greater confusion and then actually complicate our enforcement. And then lastly, down to the additional language under SIP section. What we're doing, as you'll notice, the underlined section is just adding vaping to the prohibition. And then we're actually adding a requirement to the signage, or adding to the signage requirement that you actually have to say no vaping on the signage as well. And then lastly, this is really kind of some additional language, but it's also clarifying. The new language has to do with the reinspection fee. This is actually allowed under the SIP law, and it's common practice for us and for other jurisdictions. We just wanted to simply put it in here and make it very clear to everybody that would happen. Effective date. We're looking at an effective date. The proposed is July 1st. So this will give us time to educate business owners. It will give us time to educate the public, as well as provide signage to them. Part of the effective date may depend on whether or not the board delays a significant period of time in trying to do this, but we figure if you pass in February or March, that gives us at least 90 days. So again, just reiterate kind of where we are. Currently have the public comment period going on. We've only received 15, 20 comments at this point, which we're actually kind of surprised about. A quick sample of what we're hearing. Concern over the chemicals in the e-juice and the potential for what's called popcorn lung. So there is some support for an exception for vape stores. Belief that e-cigarettes are not safer than traditional tobacco. Some concern expressed over secondhand vapor. Support for people's right to vape, but not to subject other people to the aerosols. People are not necessarily convinced that vaping is safe. And some are saying that vaping is not different from smoking, so the same standards should be in place. So public hearing expected next month. We don't know how many people are going to show up to that hearing. It could be a long meeting. We may have to enforce some pretty short comment periods. We'll just have to see what happens at that meeting. And then again, option to vote in either February or March is what we're proposing. So I see Shelley's ready with some questions. Questions, discussions, comments?
So we'll go Shelley, Ben, and then Keith.
Sorry,
go ahead.
I just had a clarifying question. So, like looking at 3 on your, it's on the resolution.
Okay.
Where you added the place of employment also means an outdoor venue.
Mm-hmm.
That section. So is that not currently in the law for cigarettes?
No, it is currently in there based on the way they define things. We're just making it very clear because we keep getting questions about that.
Okay, so it's not, you're not creating something new, you're just restating it.
Yeah.
Okay, and then I'm assuming going up one more to number 2, in that bottom one where it says public places, place also means any public or private place, that paragraph. And then the last sentence right above that, I'm assuming you don't see any conflict in those two, Michelle.
Are you talking about
where it says
chapter?
So it's all under number 2, but the very last paragraph where it says public place also means any public or private place that's open to the general public, that one. And then right above that, this chapter is not intended to restrict smoking in private facilities, which are occasionally open to the public. You don't see any conflict between those two?
I don't, because that underlined piece that we're adding comes out of the state Supreme Court decision interpreting the SIP.
Okay. Those are, my clarifying questions is all I had.
Thank you.
So I've seen a lot of these stores around, and they definitely do thrive on sampling. So how many are there?
Do you know how many?
So,
Paige, you want to come up, please?
They're not required to have a license, so we don't know exactly how many there are.
It's not a big license.
Right.
It's just their retail store.
Exactly. So the best way that we have found is to do a Google search, and we came up with about 21 stores in our county.
Yeah. And that's really those that sell vaping devices as their primary business. Vaping devices can also be sold at a lot of the convenience stores, gas stations, any of that kind of stuff. So.
And then, can we get a copy of the public comments about at least a week before?
Yes, they will be in your packet. Yes. And what we'll probably do is give you verbatim as well as do it like a theming of what we're hearing.
No. I'm done.
I have 2 questions. One does relate to the public place and place of employment. And it says it includes vehicles, but...
Vehicles? Is that what you have?
It says public place is any building or vehicle. And then under employment, I assume it's very similar. But so let me just clarify that would include any vehicle that someone is driving as an employee of some business then, correct?
If it is a vehicle where multiple people use it, that is the typical understanding that I have.
Say that again?
A vehicle that multiple people use.
Yeah,
that
where
becomes
are
a
you
public
at
place.
exactly? Can I see what language you're looking at? Just
Well,
so I can
it's
track.
under number 2, public place.
Public place means that portion of any building or vehicle.
Right, and just to clarify that part is already in the SIP. That's not ours.
Yeah.
And so it's got to be used by and open to the public, that vehicle.
Okay.
Yeah. So if it is, say, a vehicle
bus.
in an employment setting, if multiple people are coming and going, then it falls under.
So my question then is, we've had a lot of discussion about distracted driving issues, which really talks about not just public but private. And I know I've gone by any number of cars with a vapor cloud around the driver, so they can't see where they're going. And anybody else in the car is clearly affected. But this isn't going to touch any of that. And there is nothing in the distracted driving conversation that would relate to any of what we're trying to do here with the vapor.
Not necessarily in terms of the proposed legislation. There is a lot of discussion at the legislature right now when they're looking at, it's mostly addressing, texting and mobile devices is what the distracted driving stuff is really focused on. There's a lot of discussion about, well, if you're going to ban that, should you ban children in the back seat because they're distracting too, or, eating a hot dog or whatever. So, it's being discussed, but is that being put in as part of the legislation? No.
Okay.
There have been proposals in the past, just so you know, that would prohibit smoking in vehicles if there were children present, but that was not passed.
Okay. So, and then my second question, you talked about the fact that other jurisdictions within the county were influenced by
the initial Board of Health resolution?
The initial Board of Health, and so a number of cities and others. So is that also a part of what we would do here, is make it clear that we would like to influence other municipalities or districts or whatever in terms of this?
Yeah. Well, your action would cover the entire county. So the cities and counties themselves wouldn't need to do anything. You could include, encouragement for other counties or other health jurisdictions to take the similar action.
Okay.
I will tell you right now that's already happening.
Okay.
I think there's 2 other counties looking at this right now, Kitsap being one of them, and I'm trying to remember who the other one is. Do you remember? So it is becoming a trend.
So this would be a regulation that would apply to anyone who comes into the county. So even from out of state or out of country, they have
because the requirement is on the public places and places of employment here. So anybody that's coming into them. Yeah.
Great. Thank you.
Sure.
A couple of questions. I'm sitting here thinking the days I was a high school principal and thinking about the cars, the kids, full of kids, and this would directly affect the kids in cars for vaporing. Is that right?
If they fall under the definition of a public place. But if it's somebody's private vehicle. On the school grounds? Yeah.
And I can visualize out in their parking lot, sitting in their car, smoking marijuana or vaporizing or whatever, but I think it's concerning that we might very well have. The other thing that I would like to bring forth is that I'm working with about 6 high school principals on the valley. And one of the areas, of course, we're talking about is marijuana and what's happening since the law was passed. They're saying to me that they're having at least 20 to 25% more disciplinary problems than they've ever had before. And at the same light, we're working with our prosecuting attorney so that at least school principals know exactly what they can do or can't do. But they say the biggest problem they have is with the electric cigarettes, because the kids come to smoke them before they come to class or come to school, and they're high. But they can't detect it, the fact that they've been smoking an electric cigarette, because of that there's no odor to them. And that's really a serious problem that's beginning to happen. Kids can adjust to almost any kind of regulation and make it work for them. So I'm just kind of bringing it up in some of the conversation I'm having with them at this stage.
Could you just put the slide back up with when the hearing is happening?
We're currently anticipating it for February. At your regular.
Oh, you don't have an actual date yet?
At your regularly scheduled meeting.
Oh, okay. Sorry.
Yeah, we heard pretty loud and clear working with the policy committee.
I got confused when Council President said he wanted to get the comments, but you mean all the comments that come in before we have...
And the public comment period.
Got it. Yeah. Thank you. No, I thought there was another hearing that I didn't know about. Okay.
No.
Thank you.
We heard, just so you know, we heard pretty loud and clear from the policy committee that they didn't think you would want to have a separate meeting, so we're including the hearing at your regular meeting. Can you...
What's been the pushback or the comment from the business community? Are they wanting this? Are they thinking this is an extra burden? Do you have any sense of that?
Are you talking about general business community or vape shops?
General business community.
How many calls have you gotten? 20-something?
Yeah, so in about the last 6 months, we've received somewhere between 20 and 25 just directly to my line. I do the smoking public places enforcement with questions, concerns, comments about regulating these things. So a couple a month.
Yeah. And the general, wanting it.
Yeah, or they're asking about their authority to do it.
Yeah, because part of what happens is because they know it's not law, they don't know that a business can actually ban quite a few things. Or they're worried that if they don't have the force of the law behind them, they're going to get pushback from their clientele. So there's actually quite a few businesses interested in this. We haven't done a countywide poll or anything.
So, Michelle, on page 4 or 5 of the draft resolution, towards the bottom, it's after letter D, it says 2. I don't know what happened to number 1. Just kind of in the drafting piece of it, but in the first phrase, when it says violations of RCW 70.1605, and then it says as amended by this resolution occur, as I read that, I mean, typically we don't have the authority to amend a resolution even though we are adopting, an RCW, even though we're adopting the RCW. So I'm wondering if that language should just be when violations of this resolution occur.
I think that's a good suggestion. We changed the language in a lot of it, so it didn't say amending for exactly that reason. So I think that's a good point.
Okay. 'Cause I was looking at that going, somebody's going to challenge that. And then, like I said, I don't know if it's just a numbering issue with regard to the 2 that's out in front of it. But
I think we tried to just include those sections that we were changing.
Okay.
And if we didn't make any, otherwise it would have been really thick.
Right. It was just,
The 2 comes from the RCW itself. It's that, it's number 2 paragraph in the resolution. So we're just showing you that paragraph.
Got it. Okay. Thank you.
One more.
Mr. Lutz.
Okay.
Excuse me, just a point of clarification. When Councilman Hafner was talking about kids smoking in a car in a parking lot, is that a violation of SIP?
I'm going to ask for Michelle's concern on that, because it would be a private vehicle, but you're on school property.
But if you're outside of 25 feet of the entrance.
Yeah, I don't think that you would get the school to enforce SIP in a student's car, even if the car is on the parking lot.
Right.
But if they're standing in the, then they probably would.
Okay.
Yeah, there's actually, some of the schools already have policies that prohibit smoking and vaping on their entire property. And under some of the proposed state legislation right now, it would require schools to have such policies.
Okay.
And I'll say it, they're minors. It's illegal for minors to do it anyway. It doesn't matter what's where they're doing. Yeah.
It's illegal for minors to possess.
Yes.
It's a matter of being able to enforce that, the manpower.
Along the same lines as that question, Uber, Lyft, so those are private vehicles, but they're being used to transport public. How does that work?
If, under the definition of public place, it is vehicles used by and open to the public.
So that would be in Uber and Lyft.
Yeah, I think at least certainly conceptually they would be included, not that we have ever tried to, I don't know how we would enforce that and find them.
Yeah.
So just to be clear, if somebody's in a private vehicle and they're within the 25 feet, that would be a violation? I don't think that's clear at all in this description. If they're in a private vehicle, less than 25 feet from the entrance of a facility, that would be a violation or not?
I don't think that would be a violation because you have to be, the vapor has to be near an opening, a door, a ventilation intake or something like that. And if you're enclosed in your car, and we're getting down to nitty gritty here, but if you're enclosed in your car, then probably not. But if your windows are open, then maybe you are, because that can get sucked into the building.
Yeah.
So
yeah,
it gives,
the intent is to prevent the smoke, the vapor from going into the facilities. So.
Does that need to be clarified in the language?
I wouldn't be comfortable adding that in because I think we're substantively changing what's already been addressed in the state law by doing that.
More questions?
Well, the 25th is going to be a fun day.
Do we have now a quorum?
Yes, so we're going to need a quorum for that meeting, and I would also remind you that, as Linda indicated, you've had quite a bit of traffic on the department and on the district's Facebook page, things like that, with regards to this. So there is the potential for significant public comment on this, so this meeting could go long. So I would say if you've got things scheduled after that, you might want to leave them open because we could be here a while.
Yeah, and based on experience in other jurisdictions, there has been quite a turnout. I don't know what to expect here given how little comment we've gotten in our public comment written period, so just don't know.
Keith?
Yeah, could I just say, I mean, reading over all the documents and everything, obviously you put a lot of work into this. I just wanted to compliment the staff and all the work they've done to put all this together. It's a lot of work, so thank you.
Thank you. Thanks.
Bob?
Michelle, this question is for you. If hypothetically, after the hearing, the board does decide to vote, for those of us who definitely will not be here, do I have any means by which I can submit a vote?
If you are able to participate and hear the entire event, you could participate by phone and vote by phone.
Yeah.
But you'd have to be able to hear the entire,
Okay.
because you can't vote if you didn't have all the information.
Roger that. Okay.
Shelley?
But, Michelle, if we don't take a vote that day, if we were to continue the hearing for decision only, these are recorded meetings.
Correct.
So in that event, Bob could.
Watch my video and then vote the next one.
Or listen to the audio.
Okay.
Yeah.
I mean, because
You could do what?
We're both out of town on the 25th.
And our plan was to put it on the agenda for potential action in February with your option to defer until March.
we can close the hearing and push it out for decision only to give those who are not here an opportunity to participate in the conversation.
Any more questions? Thank you, Linda.
Thank you.
Linda.
Board member check-in. Let's begin with Mr. Baldwin. Ms. O'Quinn. Amber, anything for board member check-in?
I think so. Thank you.
Ms. Kinnear.
Just playing the new kid card.
Mr. Mielke.
I'll just take a minute to say thank you to everyone for the opportunity to be part of this. I've been part of the health board since I started in 2004. And it's gone through a lot of changes, certainly gone through a lot of challenges, but I also think that it's a better board and a better organization than when I first got here. I will say that it has been a great pleasure working with the staff, working with Dr. Joel and with Torney, still in the same room. Again, there are some very, very dedicated individuals who have made things work in this agency. I've never met a more passionate group of folks, like I say, trying to make our community a better place. And I've had the ability to try to learn a lot over the years. I know certainly the year of the Foundational Public Health Policy Task Force, something like that. Acronyms weren't a big thing when we put the thing together, but trying to find long-term solutions for public health. Hopefully that's a long-term implementation process that I hope will continue to be effective over the years in this state so that we have a stronger public health system than what we've had. So it's been a great honor. Thank you for this opportunity, and I will not miss the meeting on February 25th.
Thank you, Todd. Susan. Mr. Lutz.
Yeah, two comments. First of all, I'd like to thank Commissioner Mielke. I've been on the board the entirety of his time here. I shouldn't say not the entirety, but I've been on the board for a number of years when Commissioner Mielke's been here, and I've really appreciated his input, his acumen of looking how public health and policy and political issues can sort of interplay, and so I've always appreciated that input. Secondly, I'd like to give my thanks to Dr. McCullough. It's been a pleasure working with Dr. McCullough the last 6 years. I think the thing that's really exciting for me, if I'm looking at his new position, is that it's going to, at some level, look to how clinical medicine and population health can interface better. And so I think, although we're losing Dr. McCullough at the agency proper, I think the community is going to benefit from his new position. So thank you.
Ben.
Glad to be back.
Mr. Hafner.
I would like to thank the staff and the board members for my surprise recognition today. It was nice to know that you're still taking care of the elderly, so thank you.
Mr. McCullough.
I look forward to working with you in my new adventure, to board members and to staff. Thank you.
So we set our next regular board meeting for February 25th. Looking forward to that one. And do I have a motion for adjournment? Moved and seconded. Discussion? None? All in favor? Meeting adjourned.